Well, over the last few weeks, we have been learning about a new supported pregnancy care concept that is now being offered right here in the Tri-Cities. It is a partnership between State of Franklin Healthcare Associates and the March of Dimes. This morning, we want to focus on why this is important and what it means for mom and baby. Once again, we have Dr. Grover May here with us, along with Vanessa Breeding, both from State of Franklin Healthcare Associates and OBGYN specialists. And guys, it's great to have you back on the show.
Thank you. We're glad to be here.
It's great to be here. Thanks again.
We're learning so much about this, and it's so different than the traditional care concept, but I know you guys have already been doing it for a while with some patients, and they really seem to be enjoying this.
They really are. They're getting a whole lot more out of being in a group setting as opposed to being in individual care. So just to recap on what it is a little bit and what it means to our patients, these are women who are in a group setting with 10 other women who are doing the same birth month that they're doing. So naturally they're in a group setting where they become close to each other and they're able to grow together and talk about things that are common in their pregnancy as they advance on. Some of the things that I kind of want to touch on real quickly is that in the group setting, they do get to meet all the providers, whereas they may not get to do that in individual group care. They also have different time slots that they can choose from. So we do offer a morning and afternoon and a late evening group. So if time is a constraint for them, teachers are able to do it because they don't get out till 3 o'clock. We also want to kind of touch base on the fact that all of their labs are done in that group setting. So they are able to have everything done aside from their ultrasounds and some of their testing where they would want it to be in a more private setting.
So that's good to know. There are things that would require a little bit more intimacy, and you have those, and those are just one-on-one.
Absolutely.
Individualized, so putting everybody at ease there. But this is a partnership that you guys are doing with March of Dimes, and I know a lot of evidence, a lot of research went into why this is successful. Dr. May, talk a little bit about that and what you've been learning when it comes to some of the results.
Thank you. The March of Dimes has done a lot of research into models to prevent spontaneous preterm birth, and that's one of the greatest benefits of this model of care is that preterm birth is reduced by as much as 30%, and some studies even more. And there's also a lower rate of elective early deliveries, which is something that we've tried as a national initiative to reduce. We see that there's greater initiation and continuation of breastfeeding. We have found that patients and providers both enjoy this model better and that they report higher satisfaction levels with it. So there's been a lot of research performed over the past 2 decades that have demonstrated that this model of care is superior.
And we're blessed to have it right here in our area. And I was thinking too, what a great way, I know as especially first-time moms, going through all of those questions and to be able to have those other moms as well to kind of help you and build a relationship and coach you a little bit too.
Absolutely. So with everybody who's together in a group setting, it kind of empowers them to be able to take care of themselves and be accountable for things like weight gain and increase in blood pressure and diet. So it not only creates that for short term, but more for long term. So they're able to kind of bank off of each other and be close in that regards.
It sounds like there's a lot of long-term benefits. If you're looking at even like you mentioned the numbers and the statistics with research, we know that the best start that we can give them, the better off they're going to be further down the road.
And interestingly, along with this best start, it's a lifestyle change. You know, and this is what makes group care in other areas like what you may be more familiar with weight loss programs where say Weight Watchers meets as a group and you see dramatic changes in lifestyle that last for much longer than the actual program itself. And so group prenatal care works very similarly in that we see improvement in long-term parenting skills. We see a community that develops and grows in places where they've come back. We have reunions afterwards for our family members to have fun afterwards too. And you know, there's also the long-term benefits of weight reduction. Pregnancy weight gain in the short term has been shown to be improved in people who participated in group care models, and that lasts longer term as well. So that's a biggie for a lot of my patients as well. They're concerned about that.
Well, and to go through that process together and to share that joy and that whole pregnancy road, and like you said, it doesn't just end after that baby is delivered. A lot of them celebrating birthdays together and keeping in touch and sharing potty training things and what's working for some. And we know after that baby is born, it's a whole new world and you're constantly learning.
It is, and it's good to be able to bank that information off of each other. You know, is my baby going through this? You know, is your baby going through this? So they're able to really kind of count on each other. It's accountability at the end of the day. So.
What's the best way to find out more information or to get involved if this is something you say, hey, I think I would like to try this. This sounds like something that would really work for our family.
So we would definitely encourage you to reach out on our website, and you can reach the office and talk to one of the call people on the other line at 794-1300.
All right. Well, Vanessa and Dr. May, thank you so much for joining us. Really interesting.
Thanks for
Absolutely,
having us.
thank you.
All right. Here is the website and the information. If you would like more, you can check it out, or you can go by the office and visit them, and they will be glad to direct you and give you some more information.